My name is Robin Young, and I'm the publisher of Orthopedics this week. And we're going to go over the forecasts. So here are the updated forecasts for elective surgeries in the United States. You may recall at our last master class, we shared Johnson & Johnson's mid-April forecast, and they were looking at a 40 to 80% of normal coming in Q3, which would be the July, August, September quarter. And they think that we will get to a normal to 115% of normal in the October, November, and December. That's the Q4 period. Well, since then, the Institute of Health Metrics and Evaluation, which is part of the University of Washington, released their updated forecast. And the really top researchers at Wells Fargo took that data, combined it with HCUP data, combined it with census data, and have released a new forecast, which tends to indicate that the rebound to getting back to work, scheduling surgeries, will likely be at the upper end of J&J's forecast that came out in mid-April. Importantly, Wells Fargo also baked in where the White House guidelines are, and just a quick reminder, they are that communities can begin to ease restrictions when there's been a downward trajectory of COVID-like cases within a 14-day period. It is noteworthy that the IHME guidelines are more conservative. They are based on one COVID case per 1 million population with a downward trend. Using that more conservative criteria, IHME is thinking or forecasting that nationally, social distancing can begin relaxing by the end of May, specifically May 27th. But importantly, different regions have different time frames. But using that more conservative data, according to IHME, 29 states are currently qualified to relax social distancing. 7 states can start in early May, 14 states not for a while. But to put this in kind of a chart that aggregates all the information, this is how, again, relying on the more conservative data, how the forecasting is looking at the moment. Apparently, Hawaii is the first state that can start to socially distance. North Dakota is the last state. But fundamentally, in the aggregate, the data is seeming to indicate that over 25% of U.S. elective procedures can start by the 3rd week in May, 50% by the end of May, 75% by the 1st or 2nd week in June, and by the 3rd week in July, 100% of the country can be relaxing social distancing and be restarting elective procedures. I'll make one final observation here. I think all of us have been focusing lately on the flu season and the possibility of a second wave. It seems to me that after July, in the August and September timeframe, a lot of physicians and a lot of hospitals are going to be really trying to pack in as much as they can in those months ahead of the flu season, just in case that second wave affects the ability to do these elective procedures.